Hi, and welcome to Chapter 8, Patient Transfer. In Chapter 8, we're going to explore the different methods of transferring patients. We use wheelchairs, we use stretchers, we may have an ambulatory patient that walks in. We may use gait belts to help assist. We may use a Hoyer lift to help assist. So one of the things that this chapter does is it gets you familiar with what are those devices that you're going to come into contact with when you start out at the hospital. So typically our patients are going to come in and they are going to come in with a wheelchair, or they're going to be in a stretcher. So because you're at the inpatient facility, those are the two main ways of transporting your patients. We do have patient transporters that will bring your patient down from the patient rooms, and then there's a holding area that we have our patients in that you typically go and you get your patient from if they're inpatient. Some hospitals do have the ER patients come in through that area and they are able to walk into the x-ray department, and you do take some outpatients in some of those facilities too, that those patients are walking, but primarily you're going to deal with a person that's in a wheelchair, or you're going to deal with them in a stretcher. I do have a video that I want you to look at. These are two students who are performing a chest exam. So they're doing a patient on a stretcher. It tells you what's wrong with what they did, and then it goes into detail about what they did right. So I want you to take a look at that video, because those are some of the things that we'll be doing in lab, and just think of yourself in that role as a student, and how would you complete that exam. Some of the transfer considerations that you need to take place of is moving patients safely across the table. So we're going to work on transporting our patients. How do you use a wheelchair for transferring your patient? How do you use your stretcher? How many people do you need to pull your patient over on the stretcher? And we're going to take a look at some videos that show you how to properly use those transfer techniques. So when you're preparing for your transfer, you do need to check with your nursing service if you're going up to get your patient to make sure that you're aware of how this person can be transported. You need to check their identification to make sure you have the correct patient. You're going to prepare your work area, obtain any equipment to keep your patient safe. Try to communicate with your patient to find out what are they able to do when transferring them, especially if they're in a stretcher or a wheelchair, because some of them will tell you I can stand just fine and they just need some assistance. Some of them will tell you I can't stand at all. So your communication is going to be very important to develop a transfer plan that's going to work for you and your patient to keep you both safe. So one of the things that we do transfer from is the bed to the wheelchair. So we do, if we have to go up to grab our patient from the room. So if you don't have a patient transporter, you may be going up to grab the patient from the bed and you're transferring them over to the wheelchair to bring down to the department. This is the same type of transfer movement that you're going to use from the x-ray table in your wheelchair or through the stretcher. So those movements that you're going to see in these videos where they have the patient in bed is no different than if you're going from the wheelchair to your x-ray table. So keep that in mind when you're looking at this week's videos. So this gives you an idea of how you're going to set your patient up and transfer. The video is going to give you much more details on what to do with that transfer, which is why I'm requiring that you watch it this week. So you are going to go through and watch the videos on how to use your gait belt, in addition to what do you do if your patient doesn't need the gait belt because they're able to just sit up and move slightly with just assistance from you. So take a look at both of those videos and just keep in mind that you will be doing that same movement to the x-ray table. So when you do bring them to your x-ray room, the big thing to remember is to keep that wheelchair parallel to the table. You're going to lock those brakes, and you do have to remove those footrests so that they don't trip over those. Your table can be adjusted to chair height, and if it is a stationary table like your fluoroscopy units will be, you're going to use a step stool with a handle to help us guide them up onto the table. So after your patient's seated on the table, you do need to raise the table to a height that's adjustable. Make sure you swing the patient's legs in a single movement So you place one arm around the patient's shoulders, one under the knees, and then kind of swing them up onto the table. Your patient's back pain, they may want to lay on a side. That's okay until you're getting ready to do your exam. Some considerations with wheelchairs is you do have some that are stroke victims. You may have a fracture of a lower extremity. They may have just had a joint replaced or a spinal trauma, so they've had surgery done on their back. And you may have some that just can't stand safely. So if you do receive a patient from a convalescent center that came in a wheelchair but they're not able to safely stand, it may be better for you to grab a Hoyer lift and transfer that patient rather than trying to fight with them, and especially if you're short-staffed in the department. So some precautions. Your book does talk about hip precautions for hip replacements. Usually these people, they're weight bearing. If they just had surgery, they can't do weight bearing. But if it's been a few weeks, their chart may tell you that they can tolerate as needed when you're doing the weight bearing. So surgery, same thing. If they've had surgery done with a posterior approach or an anterior approach, it doesn't matter. But if it's anterior or posterior approach with surgery, abduction may not be the best choice when moving them. If it was a posterior approach with surgery, you may be able to permit abduction. Again, your chart's going to tell you what your patient's able to do. But both of them, you're going to avoid adduction, and you're not going to internally or externally rotate the toes, and you're going to avoid any hyperextension of that leg. Orthostatic hypotension can occur when your patient sits up suddenly. So keep in mind that your patient may be feeling a little dizzy. They may faint. They may have some blurred vision or slurred speech. So kind of assess the situation when you go to sit them up and make sure that they're feeling okay before you proceed to transfer them onto the table. So you just need to ask and communicate with your patient on how do you feel? Are you feeling dizzy before we move? So you're going to minimize any severity of that hypertension by asking your patient to stand slowly and keep them talking while you transfer them so that they don't end up fainting on you. Or at least if they do end up fainting, you have an idea that something's not right because their speech is slurred. Also, this is one of the reasons why we've been asking you to keep your nails short, especially with the elderly. You can scratch their surface of their skin and cause them to bleed. And this can occur as little as 1 to 2 hours after a skin damage transfer, where you'll start to see bruising occurring from you transferring these elderly patients. So keep your nails short and just be cautious of where you're placing your hands when you're moving your patient. And also keep in mind with wheelchair transfers that you want to keep the strong side. So always position your patient so that he is transferred towards the strong side. So identify, especially with a patient with a stroke, what's your weak side and your strong side, that you have the strongest side towards the transfer area. You're going to lock those wheelchair locks and move those footrests out of the way on all patients. So this is a standby assist. You'll see that they're at a 45-degree angle. They took those wheelchair footrest off, and they did apply a brake to the chair, and then they're going to transfer them onto the table from a 45-degree angle. And here's an example of where they're using that gait belt to help assist and transfer them. Notice their feet, how widespread they are, and then they're pivoting when they're turning, and I have a good video that shows you how to do that. If you're doing a two-person lift, you want one first person underneath their arms, the other person's going to lift with their legs. Again, keeping proper body mechanics, keep your back straight, and then you're going to grab those legs and lift and place them onto the table. If you're using a hydraulic lift, you'll have a device in your department that you can grab. I have a video that shows you exactly how to use that and how to place that underneath your patient and then hoist them onto the table. So those hydraulic lifts are great if you have those in your department because they can take off the pressure of your back and lifting that patient with that sling instead. Typically, our patients are going to come down with a draw sheet, a slider board, or a sliding mat. I do have examples of those in lab that I'm going to show you how to use. And then we do always want to keep those side rails in a locked position, especially if our patients are impaired, unconscious. they just had a seizure. You don't want to keep those side rails down. So transport, I always keep those rails up unless I am doing an exam that requires me to move the rails down and then get those rails put back up immediately as soon as you're done with the exams. Cart transfers, we started doing some work with the stretcher. Just keep in mind that your wheels are going to be locked in place. You make sure you got the rail down when you bring it up against the table. I do recommend that you have a minimum of 3 people when you're doing your transfers, and you want to keep that side closest to the possible and the table at the same height so that it's a nice even glide for your patient across the table on that stretcher. So this is an example where they're using a sheet, and you'll see that they're rolling that sheet up to pull the patient across. I do have videos of all of these that I want you to take a look at this week. And then just remember, for considerations with your patient, explain to them. Communication is key. You got to tell them what is going on. Let your patient assist as much as possible to save on your back pain. If they're able to scoot across the table, then just kind of guide the injured part. Check with your patient before any move is attempted, and you're going to provide any positioning sponge to help maintain that correct position. And then I can't emphasize enough to transfer as a team so that you're not taking on that responsibility of pulling patients by yourself if you have somebody who can help pull your patient. So you can always call for lift help in the department, and people will come and help. So keep that in mind. So take a look at those videos, and have a great week.